Health. This podcast is for you in Umatilla County. We are going to talk about different type of topics that it's important to know and what to do in case that you are related with that topic. In this case, we are going to talk about HPV facts that can save lives. Actually, when you talk about HPV, most of the time you think about women health, women issues, but it's the truth is like HPV doesn't care about gender. So it's the lead cause, by the way, listen, of throat cancer from oral sex in men and women, and certain type can even cause skin cancer in people with a weakened immune system. The good news, it can be prevented and it can be treated, and that's the reason because we are going to talk today with our wonderful Lexi Footer, which is our nurses supervisors in every single clinic that we have here in Umatilla County, in Pendleton and Hermiston. Thank you for being with us.
Yeah, thank you.
And for those that they don't know, when people hear HPV, most of the time, it's what I think they relate this to women's health, women's issue, but what is the reality? What have you been experiencing in our clinics?
Yeah, it's definitely more than that. That's a common misconception that it's, a women's health matter, but men and women both spread HPV and get infected with HPV. And you can maybe not have any symptoms and not know that you have the infection and not know that you're spreading it. Some of the types of HPV infections can clear on their own, but it can also go on to cause more serious health issues later on too.
I was in shock when I just find out in news that oral sex is now the top risk factor for throat cancer. And how is HPV related with this?
So there's a lot of different types of HPV, but type 16 and 18 can definitely be spread through oral sex and are very serious types. They can be spread and then it can take years to cause those cellular changes that can lead to cancer. So people often know that tobacco and alcohol are causative factors for oral pharyngeal cancer, but what people don't also commonly know is that HPV is actually linked to about 60 to 70% of HPV related oral pharyngeal cancers, and that's CDC data. And so that's the power of the vaccine to help with that prevention, and it protects against 9 different types of HPV.
Wow, it's incredible. For those parents and adults actually who think the HPV vaccine is not only for teenagers or girls, what should they know about it?
So they should know it's for all genders and almost all ages. So it is anywhere from age 9 to 45, and it's for both males, females. So all genders should be getting that vaccine and be aware of the, preventative measures that are out there.
If someone's already have HPV in our community, is there anything that we can do in our clinics?
Yeah. So even if you have an infection with one type of HPV, there's still power in that prevention, and getting the vaccine can help protect against types you haven't been exposed to. So with the vaccine protecting against 9 different types, it is available up to age 26 for all, and then up to age 45 for those with increased risk factors.
Okay, and what does HPV prevention actually look like in real life beyond or the vaccine?
Yeah, so HPV is spread with close contact, and it's the most common STI in the world. So there is other preventative practices that can be put in place. So condoms, consistent condom use, dental dams are all important in decreasing transmission. When you have an increased number of partners over your lifetime, that's going to increase your risk of lifetime exposure to HPV. So decreasing partners is also important and a good thing to take into consideration. There is no HPV preventative screenings for men, and so with using those protective measures and vaccination, it's all that it really does matter. For women, there's cervical cancer preventative screenings, and so getting that pap smear when you're due is really important, and checking with your healthcare provider or gynecologist on when you had your last one is important to know, so you know when your next one's due.
So at least men can protect themselves with the vaccine as well.
Yeah.
They don't have the screen, but they have the opportunity to get the vaccine,
yes.
right? And talking about men, how does vaccinating boys and men protect the whole community?
Yes, so by vaccinating the whole community, you're decreasing that burden of that virus in the community. When we get that vaccine rate high enough, we're actually decreasing the transmission, and by doing that, less people are going to be exposed.
Okay, is what we learned back in 2020, right?
Mm-hmm.
It's about the immunity that we can create in our community.
Yes.
That's important.
Yeah.
So some people feel embarrassed to talk about HPV. What's your message for them?
Yeah, so you're not alone. It's definitely been stigmatized over time, but I feel like it's becoming more destigmatized now. And it's not shameful, and you should feel comfortable and confident to be able to talk about HPV and any of the concerns that go along with that. It's just like any other health concern, just like flu or strep throat. So bring up those concerns, talk about it with your friends and your family, and just know it's a sign of strength when you talk about your health and what you're concerned about, and it's not shameful at all.
If you're not embarrassed to have like flu or any other infection, you shouldn't be embarrassed with this either. So it is important to know and let people know about how long have been the vaccine in the United States and how many have been like using it, right?
Yes, yeah. It's been around for many, many years now, and there's been over 135 million doses given.
Wow.
Yeah, so
that's an impressive number.
Yeah.
That's a good one, actually. And if someone notices symptoms or has any concern, what's the first step they should do?
Yeah, so
getting
into care early is important. Being open and having honest conversations with that trusted healthcare provider is so important, because by doing that, you're going to get the best feedback possible and the best and most appropriate plan and information to move forward.
Oh, that's good. It's easy. It's nothing complicated. So if we can leave a powerful fact to our viewers right now, what would be?
HPV vaccination is very powerful. It's just the most important is to get it before you're exposed if you can. It is open to ages, so starting at 11 or 12, but they actually have changed those recommendations to start at age 9. If you get the vaccine before you're 15, it's only a 2-dose series. And if you start it after, because you need that little bit more extra protection to get that immune system ramped up, it's 3-dose series. So there's a benefit with starting it early too.
So that's something positive.
Yeah.
And we have to send the message to those parents and those teenagers to protect themselves and our community as well. So thank you very much, Lexi, for all this information. And if you need anything else, you can reach us in yukohealth.net. Also, you can call us, send us an email, or we are very active actually in our social media. So you can always leave your message and we will get to you back. Thank you so much.